Dental care is a vital aspect of overall health, but many modern dental treatments carry potential risks that are often overlooked. While these treatments can be effective in addressing immediate dental issues, they may also pose significant dangers to long-term health. Understanding these risks can help individuals make informed decisions about their dental care. Here we explore the 8 most concerning dangers of current dental treatments. 1. Toxicity of dental materials. One of the most significant dangers of modern dental treatments is the use of toxic materials, particularly in dental fillings and restorations. Amalgam fillings, which have been widely used for decades, contain mercury, a known neurotoxin. Even though the dental community has long argued that amalgam fillings are safe, recent studies suggest that mercury vapor can be released from these fillings over time, potentially leading to mercury poisoning. Symptoms of mercury toxicity include neurological issues, immune system dysfunction, and kidney damage. Additionally, some composite fillings and dental adhesives contain bisphenol A, BPA, a chemical linked to hormonal disruptions and other health issues. 2. The potential risks of porcelain teeth. Porcelain teeth, commonly used in crowns and veneers, offer an aesthetically pleasing solution for damaged or discolored teeth. However, there are several dangers associated with them that patients should consider. One major risk is the potential for the porcelain to chip or crack under pressure, especially if the patient has habits like teeth grinding or biting hard objects. Once damaged, porcelain restorations are difficult to repair and often require replacement, leading to additional costs and procedures. Another concern is that porcelain, although durable, can be abrasive against natural teeth. Over time, this can lead to the wearing down of the opposing natural teeth, causing sensitivity or further dental issues. Moreover, the process of placing porcelain teeth involves the removal of a significant amount of the natural tooth structure, which is irreversible and may weaken the remaining tooth. Additionally, if the porcelain is not properly fitted, it can create gaps that trap food and bacteria, increasing the risk of decay or gum disease. Finally, some individuals may experience allergic reactions or sensitivity to the materials used in the bonding process. While porcelain teeth offer cosmetic benefits, these risks underscore the importance of careful consideration and consultation with a dentist before proceeding. 3. Potential for misalignment from orthodontics. Orthodontic treatments, such as braces and clear aligners, are widely used to correct misaligned teeth and improve bite function. However, these treatments are not without risks. For instance, improper application of braces or misalignment of the aligners can lead to unintended consequences, such as jaw pain, temporomandibular joint, TMJ disorders, and even damage to the teeth and gums. Additionally, the prolonged use of braces can make oral hygiene more challenging, increasing the risk of tooth decay and gum disease. In some cases, the teeth may relapse into their original position after treatment, leading to the need for additional interventions. 4. Risks of root canal therapy. Root canal therapy is a common dental procedure aimed at saving a tooth that is severely decayed or infected. However, this treatment carries significant risks. During a root canal, the tooth's pulp is removed, and the empty space is filled with a sealant. While this may relieve pain and preserve the tooth structure, it can also lead to complications. One major concern is that bacteria can become trapped inside the treated tooth, leading to chronic infection and inflammation. Some experts believe that these hidden infections can contribute to systemic health problems, including heart disease, arthritis, and autoimmune disorders. 5. Complications from dental implants. Dental implants have become a popular solution for replacing missing teeth, offering a permanent and natural-looking alternative to dentures. However, the process of installing implants involves significant risks. The surgical procedure itself can lead to complications such as infection, nerve damage, and sinus problems. Moreover, if the implant does not integrate properly with the jawbone, it can fail, leading to the need for further surgery. Long-term dental implants may also contribute to bone loss in the jaw, especially if the surrounding tissue becomes inflammation. 6. Overuse of antibiotics. Antibiotics are frequently prescribed in dentistry to prevent or treat infections, especially before or after procedures like tooth extractions or root canals. While antibiotics can be life-saving when used appropriately, their overuse in dental care has contributed to the global issue of antibiotic resistance. This resistance occurs when bacteria evolve to become immune to the effects of antibiotics, making infections harder to treat. Moreover, the unnecessary use of antibiotics can disrupt the balance of beneficial bacteria in the body, leading to issues like digestive problems and weakened immunity. 7. Aesthetic risks. The pitfalls of cosmetic dentistry. Cosmetic dentistry, including procedures like teeth whitening, veneers, and bonding, has become increasingly popular. However, these treatments carry their own set of risks. Over-whitening can lead to tooth sensitivity and enamel damage, while poorly placed veneers or bonding can cause misalignment or gum irritation. Furthermore, cosmetic procedures are often irreversible, meaning that any mistakes or unsatisfactory results can be difficult or impossible to correct. Patients should carefully consider the potential risks and benefits of cosmetic treatments and choose a qualified, experienced practitioner. 8. Nerve damage, a potential complication of dental procedures. Nerve damage is a rare but serious complication that can occur during dental procedures such as tooth extractions, implant placements, or root canals. Damage to the nerves in the jaw or face can result in numbness, tingling, or pain, which may be temporary or permanent. While experienced dentists take precautions to avoid nerve injury, the risk cannot be completely eliminated. Patients should be informed of this risk before undergoing procedures and should report any unusual sensations to their dentist immediately. If you are planning to visit the dentist and considering any dental treatment options, make sure to carefully evaluate your options. Natural remedies. One popular method is the use of baking soda as a gentle abrasive to clean teeth and neutralize acids that can lead to cavities. Its mild abrasiveness helps remove surface stains, while its alkaline properties balance oral pH, reducing the risk of enamel erosion. Another natural remedy is oil pulling, which involves swishing a tablespoon of coconut oil or sesame oil in the mouth for 15 to 20 minutes. This practice is believed to help reduce harmful bacteria, improve gum health, and whiten teeth. The oil's antimicrobial properties contribute to better oral hygiene and can complement regular brushing and flossing. Herbal remedies also play a role in natural dental care. For example, green tea contains antioxidants that can help reduce inflammation and fight bacterial growth in the mouth. Additionally, clove oil has been traditionally used for its analgesic and antiseptic properties, providing temporary relief from toothaches and gum discomfort. Aloe vera is another natural option, known for its soothing and healing properties. Aloe vera gel can be applied directly to the gums to reduce inflammation and promote healing in cases of gum irritation or minor mouth ulcers. Finally, a diet rich in crunchy fruits and vegetables can naturally clean teeth and stimulate saliva production, which helps neutralize acids and wash away food particles. Apples, carrots, and celery are excellent choices for supporting dental health through diet. If you enjoyed this content and found it helpful, please give us a thumbs up, share it with others, and subscribe to our channel. We'd also love to hear from you. Share your experiences with any harmful effects you've encountered from dental treatments in the comments below.